Hello, my name is Dr. Lars Erik Larson, and I'm a chiropractor. Welcome to today's workshop. Now, my mission as a chiropractor is to educate and check as many individuals and families as possible in regards to their spinal health. Today's workshop is going to focus on optimal health and healing. Just a little about me first. See, I went to school in Atlanta, Georgia, at Life Chiropractic College. And it was there that I learned just how powerful a chiropractic adjustment could be on your health. Now, one of the things that amazed me when I was there in school was how effective the chiropractic adjustment was on children. And that's where our story really begins. Because, see, as we enter life, we're all born, and that process can be very traumatic. And once we are born, children fall down. And this starts a process wherein your spine can start to be affected. And since my role as a spinal specialist, I love to check children. In fact, I welcome and encourage all families to bring their children in for a checkup, whether or not they have any symptoms. Many kids do have problems. But many kids appear to be okay. But it's very, very important to have children checked, just like you would check your children's teeth with a dentist. Now, one of the kids that was brought to me early in my career was a young girl named Sophie, and she was having ear infections. You see, before I went to chiropractic school, I had no idea that children could develop ear infections because the bones of the spine were misaligned. Now, I adjusted her 8 times. And after those 8 visits, she was not getting ear infections anymore. And this is after 10 months of repeated antibiotic therapy. And at one point, the doctor even suggested they might put tubes in Sophie's ears. And the parents were very distressed. Everyone was up all night. But after 8 chiropractic adjustments, this child stopped having ear infections. Now, I don't know if you realize this, but in 1991, the Journal of American Medical Association came out with a report that said antibiotics are not effective against recurring otitis media. That's ear infections. So we've known for many years now that when children are having repeated ear infections, it's best to either wait and see or try a different approach, because antibiotics are very powerful and they'll affect a children's health well beyond the ears. While the ear infection might clear up, you might damage the gastrointestinal lining. Now, what do we do with someone that is ill? You see, we're all searching for the answers, but you must realize that the healthcare system is crashing. Something has gone wrong. And that's because we've been taught that there's always an answer from the outside in. Call that the outside-in approach, a quick fix, a drug, something that's going to just recapture our health quickly, instead of doing what's necessary in order to get well and stay well. You see, your body has what's called an innate intelligence. It has the ability to heal itself. You start as a single cell, and from there, we're able to create this magnificent thing we call the human body. Let's compare that also to some other applications. Let's say a watermelon seed. Have you ever thought about that? A watermelon seed is very, very small. It starts off as a couple of cells. But what it does is it absorbs nutrients and from the soil and from the water, carbon and hydrogen and oxygen, and then slowly creates this gigantic piece of fruit with a protective coating on the outside and a thick white layer on the inside, and then that nice fleshy fruit that we see in the watermelon. Now, from the time that the seed is created until it's a great big fruit, it has a weight difference about 200,000 times. Now, that's pretty incredible. So that's the intelligence of the planet, if you will, or the universe, and it's in plants and seeds, it's in animals, and is also inside the human body. So as a chiropractor, we want to work with that power, that intelligence. And when you receive a chiropractic adjustment, we're actually allowing the nervous system to work more efficiently. And that's where the messages are transmitted, is through your nervous system. If you go to Gray's Anatomy, it's the most famous anatomy book in the world, and you open it up to page 4, it says right there, every function of the human body is controlled by the nervous system. So, if we can affect that nervous system in a positive manner, then we can attain better health. Now, what happens to the human spine that the nervous system gets affected? It's called a subluxation. And what happens is the spinal bones get misaligned. They move. They get stuck in various positions. And when that happens, they'll affect the nerves and the spinal cord that are traveling right beside them and through the bones. And when that happens, when we have a subluxation, you have irritation or interference in your nervous system. Now, how do we get a subluxation? How is it that the spine gets affected? Well, I mentioned previously birth. Right? You could start with a traumatic birth. You could fall down. You could have something like a car accident, which is very devastating to the human spine. In addition, you could have things like emotional stress. Okay? When you're under a lot of stress, your muscles tighten up, and that puts a lot of pressure on the system, and we also tend to change postures when that happens. You could also have chemical stress. If you're eating poor foods, if you're making poor choices with your diet, cigarettes, alcohol, large amounts of coffee, prescription drugs, or junk food, that can also have an effect on all the tissues of the body, tightening the muscles, slowing down the healing process, and creating subluxations. The spine responds to this, it gets very tight and immovable, it gets locked in a misaligned position, and then the nerve is affected. I actually brought a prop here today where I can show you, and this right here is a light. I hope you can see this on the TV, but there's energy running through this light right now. And if we have a subluxation and we grab this, all the light stops. And when I release it, you'll see the light come back through there. And that's what happens inside of your body. When I make a chiropractic adjustment, and that's some type of gentle procedure where we're putting motion into the spine and allowing that bone to start moving properly and allowing that nerve to work better. Subluxations are deadly. Left unchecked and uncorrected, they'll create devastating effects in your spinal system and your nervous system for years and years to come, shortening your life, shortening the quality of life, and the quantity of years. So what can we do to correct the subluxations and avoid the subluxations? Well, first of all, we'd like to avoid as much physical trauma as possible. We want to reduce our exposure to emotional stress, and we want to have a fantastic diet. So you want to put the right foods inside your body. Now, if exercise, which creates motion in the body, and a proper diet were enough, well, then we wouldn't need the chiropractic adjustment. But we see even people with a great diet and people that exercise still getting subluxations. You see, exercise is not enough to correct the spine back to normal, and that's where the chiropractic adjustment comes in. By gently adjusting the spine, we can get better motion and movement and allow that nerve to work better, healing you from all kinds of things, such as headaches, low back pain, shoulder pain, neck pain. All of the various joints in the body can be affected when you have a subluxation. In addition, various problems in the body like heart disease and improper breathing like asthma, things of this nature can be corrected by the body. See, if the nerve works better, the body corrects its own problems. Now, what is the typical response for someone that has symptoms, we'll say here in the United States and throughout the world? Well, they take medications. See, we've been led to believe that by taking medications over and over for all of our various ailments that we are going to heal. Now, when you take a drug, you may have a curing effect. You might get rid of a symptom. However, you're not allowing the body to heal. In fact, the more drugs that we pour into the system, the more chemical stress that builds up, leading in the end to more subluxation, not less. One of my recent patients was having lifelong trouble with asthma. She was on 4 different medications for her asthma for 20 years. After receiving her first chiropractic adjustment, she came back in on a Monday morning, and I asked her about her neck pain, and she said, you know what, I was breathing better. And that's what's so important. Over this time, over the past 6 months of care with this young woman, she has been able to get off all the drugs. She's breathing better, her neck feels better, and she's just basically much more healthy. Now, what are some of the other topics that I speak about to people? Well, one of them is posture. You see, if you haven't had a tremendous accident or a sports injury or fallen off a ladder, some type of physical trauma that people typically relate to, causing their pain, it still may be that you're having poor posture. And posture is so important to the body. Let me give you an idea. From the side, the spine should have curves, and that head should really stay right over the shoulders. The shoulders should line up with the pelvis, and the pelvis with the ankle. From the front, everything should remain vertically stacked with the head right over the shoulders, and you could just drop a plumb line straight down a body in perfect posture, and it would be standing and not leaning or twisted or in any way changed in its position. But these are some of the common things that I see on an everyday basis in my office. Loss of posture leads to subluxation. Now, what's the research say about posture? Well, what we're finding out is that the more our head is forward, for every inch forward out in front of the body, you're going to add 10 pounds of weight for every inch forward. Now, the head's already heavy. A normal head can weigh in 10 to 12 pounds. But if you move it an inch forward, okay, now it's 20 to 22 pounds. That's a 100% increase in the weight distribution. If you move it 2 inches forward, that's 200% increase in the weight that these structures are bearing. When that happens, we expose ourselves to things like arthritis and nerve stretching. Okay? Arthritis is the joint getting smaller and collapsing and the body putting calcium in there. Basically, it gets remodeled. That's what arthritis is. And it responds to pressure and changes in posture. So when you have these devastating changes, you're going to expose yourself to early arthritis and lots of nerve tension. Now, I've brought a chart with me so you can see this even more clearly. Let's take a look at my posture chart. As you can see, all the way to the left, you'll see the gentleman with his head right over his shoulder. And then as we go into school and we get into the workforce, we start doing a lot of sitting. Our head starts to go forward and our upper back goes backwards. Left for a long period of time, you could develop a position where your head is really comfortable forward but doing great damage. And then the last photo shows what I call the little old man or the little old lady, where the head is so far forward. Now we've got tremendous changes occurring in the spine. And this quote here is very, very powerful. To live a long, active, energetic life, few things matter more than good posture. So how can we avoid posture? Well, in fact, I teach workshops on this issue all the time. I go into companies and I teach them right here in my office about how can we avoid poor posture. And we have to be thinking about it to some degree on a daily basis. Just like we brush our teeth, we've got to do posture exercises. And that's one of the things I specialize in, is identifying that loss of posture and then giving corrective exercises. The other thing is you might need traction to your spine. And there's several different methods, but tractioning a spine could look like this. If the head's forward, we want to pull it back into extension. And when we do that and we maintain that position over a period of 10 to 20 minutes, we can have some tremendous changes occurring in the ligaments of the spine. And by correcting the spine, getting it back into a normal position, and by correcting the posture, we can reduce and eliminate the subluxation pattern. I also take x-rays in my office. So let's take a look at some common x-rays, and I'll give you some information about what a normal and an abnormal neck x-ray looks like. Both of these pictures are taken from the side. The one on the left shows a head going forward. And if you can see on your screen, there'll be two lines. There's a dashed line on the back of the vertebra, and then there's a solid line that has a curve to it. And that dashed line should actually be sitting right on the black line. So if those were matched up, that would be a more normal curve. In the picture on the right, you're going to see how those two lines match up. It's slightly dark on that right side. I do apologize for that, but you can see how the curve changes by the head position coming backwards. This is called a phase 1 condition. Let's go to our next slide. Now in this condition, the person on the left, this is before chiropractic care, got involved in a car accident. And her neck is actually going backwards, meaning the bones of the spine are back behind that natural curve line at the bottom of the spine. And at the top of the spine, the bones are going forward. And that creates a tremendous problem for the nervous system. And many times, this is extremely painful. Headaches, neck pain, shoulder pain, things of this nature, very common with this type of disorder. And on the right side, you'll see aftercare. You'll see those bones lining up more in line with the black line. So as we change that curve with exercises and traction and chiropractic adjustments, this person's health skyrockets. In fact, she had a lot of pain, a lot of jaw pain, interestingly enough, and now she's on a wellness care plan. Let's take a look at one more slide. Now this shows on the left a normal curvature with the head upright and the bones following along that black line. And the right side is a gentleman that's never had chiropractic care. This is one, you can barely see the head. The head is so far forward. In fact, it's 90 millimeters further out in front than where it should be. And what's happening in that spine is just tremendous changes of things like arthritis and a lot of pulling and stretching of the nerve throughout that. And this gentleman, in fact, was taking a lot of drugs to try to correct the problem. And of course, that's not the answer. So, what types of care do I offer for my patients? Well, there's 3 types of care. Typically, when a patient arrives at my office, many of them have some type of symptoms. So I'm going to do my absolute best to get the symptoms resolved, to actually get that person feeling better. So that's really initial intensive care, where we're working with the person. Typically, we've had stuff that's been there a long time, meaning muscle tension and bone misalignment. So even if you had a current injury, typically it's on top of something that's happened in the past. So that initial intensive care is designed to reduce the symptoms and get you feeling better. Then I'll typically move into what's called a corrective care plan. And that is designed to actually change the spine. We want to get that spinal curve back to a normal position, and we want to get the posture back into a normal position. And we do that through exercises, with traction, and with the chiropractic adjustment. Now, once someone has their spine corrected, once their symptoms have died down, well, then I offer wellness care to my patients. And that would be the type of care that I'm under. After 20 years of chiropractic care, I'm on wellness care. And the reason that I keep going is to maintain my spine in a healthy position with lots of motion in there, make sure that that nerve works correctly. And a wellness care plan could be different for many different people. I do recommend that no one go beyond a month without a chiropractic checkup. That's the longest that I would go, and that's the longest I would recommend for my family or my children, my friends, and any of my patients. Typically, I will get adjusted in my wellness care plan once a week or every 2 weeks. And that's a fantastic program. It's kept me healthy for many, many years. I don't get the symptoms. I don't get the colds and flus that other people get. I maintain my exercise plan. I eat good foods, and I get my chiropractic adjustments. That's what's kept me healthy, and that's what I want for you. Now, what other types of things do I offer in my office that can help you achieve optimal health? One thing that I found that's really fantastic is orthotics. Now, orthotics are designed to improve the arch of your foot. So if you have flat feet, by all means, ask me about orthotics. If you have knee pain or recurring hip pain, sometimes the orthotic can make the huge difference getting you back to a normal gait and a normal arch. This orthotic is designed in the United States. It's state-of-the-art. It comes from a company called Soul Supports, and this one I highly recommend. It's the one that I wear, and I'm wearing it preventatively, but I recommended it pretty much on a weekly basis to all of my patients. In addition, I myself take vitamins, so I do recommend vitamins to my patients. Everyone should be taking a multivitamin. I brought with me today a calcium product. All women certainly should be getting plenty of calcium. You might think you're getting your calcium from, say, dairy products or other types of foods, but many times the calcium is bound up and you're not absorbing as much as you might think. So calcium supplementation for women is mandatory. Other things like antioxidants and fish oils and flaxseed oils are also really, really important. It's going to help you achieve optimal health. One of my things I'd like to share with you today too is a video. It's a short clip. It's from a mission trip that I went to in the Dominican Republic. I donated my time and went down there with 7 other chiropractors in 2006. And I'm going to show you a short clip here. I actually adjusted 1,400 people over the week myself. The group adjusted 10,000 Dominican people. But let me show you a short clip here so you can get an idea of what a chiropractic adjustment looks like. Let's take a look.
Tell her it's just gas, just air.
Yeah. Este parece, doña, para hablarle en el cuello y para que se relaje.
No problem.
Que no hay problema, que eso es lo que está buscando él, ¿no yo? Tranquila. Más suavecito.
The nerve for the shoulder is from here.
She has pain from the shoulder, yeah.
Yeah, and the nerve is
Yeah.
from here. So we adjust the bone
Yeah.
to make the nerve work better. For the
Okay.
Mhm.
Él analizó eso y ahora los nervios del hombro le van a funcionar mejor y le van a ver menos. porque a veces los hombros se construyen por la vértebra. Ahora vamos a sentarnos. Aquí quieres así, los brazos cruzados así, ¿ok?
So that's an example of several of the adjustments that I performed in the Dominican Republic. You might have seen me adjusting the neck. Many people would say, oh, I don't want to get a chiropractic adjustment because my neck will break or something like that. Well, it's a gentle, gentle force, okay? You saw how easy I was moving the spine. And when we have an adjustment such as that, gas can sometimes be released. You'll hear a popping sound. That's just gas coming out of the joint. However, for all of my patients that don't like that typical procedure, there are other ways to adjust the spine. So believe me, there's many, many ways that we can address the subluxations in your spine. I have specialized tables which allow us to put motion into the spine so the table moves, very gentle. So there's no reason ever to fear a chiropractic adjustment. They feel great, and most of my patients are smiling and laughing after adjustment, as you saw the woman there. Now, that trip to me was one of the highlights of my life. I was able to go down there and help just so many people. Obviously, many of them very, very poor. We went into neighborhoods and medical clinics. We went into schools. Several of the days were adjusting school children for the entire day. And we had a lot of miraculous stories down there. And it's something I want to do every year for the rest of my life. Now, I'm going to end with a really amazing story that happened to one of my patients in my clinic here in the States. And a young woman came into my office with a lot of neck and back pain. And after interviewing her, I found out also that she was no longer having her menstrual cycle. Now, this is a serious concern because, if you're not having the menstrual cycle, obviously that's going to create other problems. This young woman was 17 when the cycle stopped, and now she's 22. She's a college student. I asked her what happened, and she said really there was no cause. It just came on, and first the doctor said it was from too much exercise, and then from under-eating, and then she even tried to get on the birth control pill. None of that had any effect whatsoever. So I was able to put this young woman under care, and by adjusting her spine, not only did her posture get better, did her neck pain and back pain get better, but within a matter of weeks, she started a normal cycle. That, to me, is really the amazing part of chiropractic. And the next time she came in, after she had that first cycle start up, she gave me a big hug, and she said, you know what, you saved my life. And I believe that's true. In addition, we may have also created another life, and nothing is bigger than that. I hope you learned a lot today. Please, if you're having any type of symptoms, if you like a posture check, if someone that you know is having trouble, please get in